All right, good afternoon, everyone, and welcome. I'm Bruce Barnum with the Colorado Center on Law and Policy. It's wonderful to see so many of you with us tonight, both in person, where we have a full house for those of you watching online. I know you can't see the crowd, but we've got a very full room. We've got about 65 or 70 people with us here, full house at the Health Capitol, so it's great to see that. And I know we've got almost 300 people registered for the online session, so big turnout for this evening's event. Really appreciate that. Thanks for taking the time this evening to join us. I think everybody's eager to hear about what promises to be a complex, fast-moving, and consequential legislative session. This event is designed to help ground all of us in a shared understanding of the policy landscape that we're walking together into this year. But before we dive in, we want to cover just a few quick logistics. First, we are providing live simultaneous interpretation in Spanish this evening for the folks online from Community Language Cooperative, who is providing our interpretation for today's event.
Awesome. Thank you so much. Hello, everyone. My name's Itzel, and I'll be providing the simultaneous interpretation for the folks online. And a reminder that I'm here because the organizers of this event have made a commitment to language justice. So we want to ensure that everyone is able to listen and be heard in the language of their hearts, which is the language that we're most comfortable in.
So one of the things that's always grounded our annual legislative preview is the belief that strong policy outcomes come from partnerships. None of our organizations do policy work in isolation. And none of the issues that we are facing this year, whether it's budget constraints, healthcare affordability, consumer protections, or the future of public benefits, can be understood through a single lens. So now I want to formally welcome you to the part that you're really here for, the core of today's program. So on behalf of CCHI, the Bell, CFI, and CCLP, we're going to get our legislative preview started. So I'll just note that this year's session is unfolding against a particularly challenging backdrop. We're entering a legislative year shaped by deep fiscal uncertainty, openly hostile federal policy signals, ongoing affordability pressures for Colorado families, and renewed debates about how and for whom our state budget works. So the goal of this preview is not to predict every outcome, but is to help us all understand the terrain, where the pressure points are, what policy conversations are already taking shape, and what coordinated advocacy can do to make a real difference. So tonight you're going to hear a series of short, focused presentations from a pair of advocates from each organization, moving from the larger fiscal landscape into specific issue areas. Together, they are meant to build a shared picture of what we expect to see during the 2026 legislative session and what it will take to protect and advance equity, affordability, and accountability in Colorado. So we're going to begin with the budget and fiscal context, which is shaping everything else that follows. And then we're going to move through tax policy, healthcare affordability and oversight, medical debt, public benefits, consumer protections, or finally opening up things for a Q&A where you can ask these fine advocates anything that you would like to. So really grateful for the panelists joining us today. They bring deep expertise, real-time policy engagement, and years of experience navigating the legislature and state agencies. So first, I'd like to welcome up Caitlin Schneider and Kathy White from the Colorado Fiscal Institute, who are going to help us understand that broader fiscal landscape and the tax policy proposals shaping this session.
Thank you all. I'm disappointed that the priorities in the mentee did not include fair tax code, fair tax policy. Felt left out.
No, that's fine. It should, because that's what we're talking about today. Really serious topics. Hi, everyone. I'm Caitlin Schneider. I'm the outreach director at the Colorado Fiscal Institute. And for those of you who don't know CFI, we are a statewide policy advocacy organization that really uses research, legislative and ballot advocacy, strategic communication, and statewide education to advocate for tax and budget policies that help drive forward a people-centered economy. And so we're here today because we're going to talk very quickly. I'll talk a little bit about the fiscal landscape that our legislators are stepping into as we kick off the 2026 session. And then I'll hand it over to Kathy White, our executive director, to talk about our legislative priorities. So if we want to go to the next slide, Carly. I'm going to talk about the current landscape really quick. And as that mentee suggested and what Bruce said, really legislators are coming back and kicking off the 2026 legislative session to another tough budget year. They will be making some really hard decisions where to find more cuts and fill in this budget hole that we are facing. Where you saw we are looking at over $800 million in budget deficit. And so I'm not going to talk too much about this chart that is in front of you, except that this year, when we are thinking about the fiscal year 26-27, our budgeting for it, we are actually below the allowable cap that is set by our tax code or the Taxpayer Bill of Rights or our TABOR cap. We are below that, meaning we are not bringing in enough revenue for our legislators to even be able to budget to the allowable limit that they are. So on top of the budget deficit that we've been talking about for the last several years, meaning that we have not been able to keep up with caseload growth and inflation and having to make cuts even in years we're above the budget cap, we are limited in the budget cushion that we have. So if we don't bring in the projected revenue that this chart is showing, more programs are going to be on the chopping block of what our general fund funds, like healthcare and higher education and K-12 education. And so we're projected to be $465 million below that. On top of not only having those cuts, we are also going to be those priorities that we usually fund with our with money above that revenue cap, like our senior homestead exemption and tax credits for working families. Those are also going to be competing now with our general fund. And so one of the policy decisions that is exacerbating this budget shortfall of why we're not collecting enough revenue has to do with some of the federal decisions that were made this spring and summer, right? The House Resolution Bill 1, HR 1. And so those impacts that we are seeing and repealing in Colorado's budget. And so at the Colorado Fiscal Institute, we like to talk about HR 1's impact in two different ways. The spending side, which we all know HR 1 makes incredible cuts in work requirements for important safety net programs like Medicaid and SNAP, all being paid for, or these cuts are paying for tax cuts that go to the wealthiest Coloradans.
Boo!
Trillions of dollars worth of tax cuts that go to corporations and the wealthiest among us. And so at CFI, when we talk about the tax side, we know that HR 1 permanently extended the 2017 Tax Cuts and Job Acts and introduced new deductions for individuals and corporations, mostly benefiting the upper income households. And that impact in Colorado taxpayers, as we saw from just the immediate impacts as soon as HR 1 was signed into law, we know that the richest, the wealthiest 1% in Colorado, and so those making over $800,000, saw about a $72,000 tax benefit immediately, while the lowest earners in Colorado only saw about a $70 tax benefit. That's 1,000 times difference. And this is largely due to our tax code is tied to the federal tax code, meaning any change at the federal level, Colorado's tax code automatically absorbs. We are in a rolling conformity state. And so the things that we have to, so immediately we lost that revenue that we gave the top earners a $72,000 tax benefit while not giving our working families barely anything. And so on top of that, when we look at Colorado's tax code, it continues to create a more upside down tax code for Colorado. And so when we look at all Colorado taxpayers and we put them on this chart, we see that the top 1% of Colorado earners are actually paying a smaller percentage of their income in taxes than the lowest 80% of Colorado earners. And so we know that we have to do something in the constraints of TABOR and the tax code that continues to leave us vulnerable. We know that there are limited things that we can do this legislative session, and I'm actually going to pass it now over to Kathy to talk about that. And I think I made it within my 5 minutes.
You might have. Yes, so I just want to frame what we're doing this legislative session with the fact that Congress took action that our state legislators did not. And because of that action, it had an effect on our tax code because, again, we're tied automatically to the federal tax code. So it was in effect like Congress giving rich and very wealthy Coloradans a tax break, and at the same time taking away a tax break, a tax credit that we know is very effective that our own state legislators passed 2 years ago, and that is the Family Affordability Tax Credit. It is like an expanded child tax credit. It is really one of the most effective credits that we know of. It's a model for other states, but because of the actions of Congress and passing the budget resolution that they did over the summer, it had such a significant impact on our revenues that it turned that credit off. So what we are going to do this year is that we're going to work a little bit more to make sure that Colorado's tax code benefits Colorado families and Colorado businesses. Because of the way our tax code is tied to the federal, those many companies and very wealthy individuals got a tax break even for activities that they do not do in Colorado. So it's not economic activity that we get here. It could be done in New Jersey. It could be done in Texas. It could be done in a lot of different places, but they get a tax benefit here just because of the way we're tied to the federal government's tax code. So the 4 things that we're going to do this year, we are going to continue to decouple from things that were new or expanded in HR 1. These are big tax breaks for buying property and building a manufacturing firm. Again, doesn't necessarily need to be a manufacturing firm here in Colorado. It could be anywhere, but because of that, we give them a credit. We also have another bill that's going to hold corporations accountable for paying their fair share. This is, did you know that a corporation can pay their top executives, their C-suite executives, $10 million or $20 million? And they actually get a tax break for doing that. They can deduct that from their taxes. HR 1 actually limited this as a part of saving some money, but Colorado could completely decouple from this or disallow that credit to be taken in our state. Again, these could be C-suite executives that do not live here. They do not shop here. They might play here in Aspen, but that is, again, our children in our schools and our families here in Colorado shouldn't be footing the bill for corporations that want to pay their executives this executive compensation. The third bill that we have is just to modernize Colorado's tax code. Right now, if you go into a Best Buy, you're 80, you're my dad, and you go into a Best Buy because you want to buy Microsoft Word and you like to look at the box and read it and take it home, you pay sales tax on that software. If you are somebody else, not my dad, and you download that off the internet, you do not pay sales tax on that. And so one of the bills that we have is just to say that it shouldn't matter who you are, like how you prefer to purchase a good, you should be able to be treated the same by our tax code. So we're going to apply that same tax, that same sales tax to a downloadable software so that whether you go to Best Buy or you download it off the internet, everybody pays for that. We apply our sales and use tax to that thing. And then finally, we have a bill that is just cleaning up the tax code. The Office of the State Auditor goes through every year and says, what are these things? Who benefits from them? And recommends taking them out of the tax code just to clean it up. And this bill is just a series of cleanups. It's things like gold bullion. So if you want to sell some Cougarans that are under your bed, go ahead and sell those now because they're not going to get a sales tax exemption. Your buyer's not going to get a sales tax exemption if this bill passes. It's also the case that during special session, we took away a kickback that retailers got for just collecting and remitting sales tax and sending it back to the state. We got rid of that, but our tax code has some weird, like just orphan products in it that get a vendor credit still. They still get that kickback. So, and it's things like nicotine and tobacco products. And so you could be a retailer and you could be selling things like socks and shoes. You won't get a vendor credit for that. But if you sell tobacco and nicotine products, you will. Cigarettes, you know. So that's, again, just something that we're going to clean up. So those are the 4 bills, but they really are ways of using our tax code to be efficient and effective and targeted at benefiting families who live here, to credits that we know benefit every single community in Colorado. They have a positive economic benefit. The family affordability tax credits that we're going to take money from these tax credit, closing these corporate tax loopholes and drive it into that credit. We know that that credit reduced child poverty in our state by 40%. We know that when families get economic stability, it created housing stability. It created job stability. And when you create that kind of stability in a young child's life, the dividends that you get from that are returned over and over and over again, well into the future. Those kids earn more, they do better in school, and they have better health outcomes, which saves us all money in the long run. So that's what we're doing with the tax code this year. And we would love for you all to join us and to reach out if you have any questions.
Good evening, all. My name is Isabel Cruz. I use she, her, they pronouns. I'm the Policy and Advocacy Director for the Colorado Consumer Health Initiative. If you're not familiar with us, we are a nonprofit, nonpartisan, membership-based organization that seeks to ensure all Coloradans have equitable access to high-quality, affordable health care. We have our policy and strategic engagement teams, as well as a consumer assistance program that has helped save Coloradans almost, not quite, $13 million since 2018. Woo woo! Yeah, you'll notice that I don't have a partner today. So shout out to Sophia Hennessy, my policy and research coordinator, who in an abundance of caution for public health is not here because she was sick over the weekend. And so I will be talking about the bills that I was assigned, and I will be as replacement for Sophia. So I am going to walk us through 3 of the priority bills that we are working on this year in coalition related to 2 of our key policy pillars, which are access and coverage and consumer protection and industry abuses. These are not the only things we're working on. So if you're curious at looking at our policy priorities, those are available in English and Spanish in a link in the resource document that everybody will get. And we probably have some in the room. But I will start with a bill that the moral of the story here is you're going to recognize some of these from last year. So we'll start off with talking about mergers and acquisitions. So why are we working on this? I believe that probably most of us in this room and online, and we know that a majority of Coloradans think that healthcare is too expensive. So we at CCHI are committed to addressing some of the root causes and drivers of the high costs of care to make care more accessible and affordable for people. And so one of the drivers of the cost of care that we know is increasing corporate consolidation in healthcare and monopolistic behavior, right? So we know that the majority of metro areas and regions across our state and across the country are highly consolidated, meaning there's not a lot of competition between healthcare entities, which has significantly been linked to increasing prices. And we know that Coloradans are starting to catch on to this. The majority of people attribute, at least in part, the corporate power of large hospital provider groups and private equity groups to why healthcare is so expensive and believe that we need to do something about it. And we've talked to people from Sterling to Durango to Fort Collins to around the metro area about how consolidation in their area has had an impact on their access to care, from more limited services available at their hospitals or at their physicians' offices, to longer wait times, to more turnover and challenges contacting their doctors, and more unexpected changes in what their insurance will cover. So we know that these mergers and acquisitions, when done poorly and done only for corporate profit, can really damage community trust and strengthen folks' resistance to accessing needed care and to waiting for the last minute, right? And so we know also, we talked about HR1 a little bit earlier, that there is increasing risk to our rural providers especially, but to healthcare providers in general, particularly the ones who are struggling the most financially. And so there is more risk of continued consolidation, and we know that the federal government has decreased appetite in doing anything about it. So our state must do something about it. So last year, there was a bill, SB 25-198, that failed in the Senate. But the sponsors, including Senator Kipp, Senator Weissman, and Representatives McCormick and Brown, had weekly meetings over the summer that were a blast for everybody involved to talk about trying to come to the table to figure out folks' concerns. I'm not optimistic based on how conversations have gone so far that there's going to be a path forward that's going to make everyone happy. But there is going to be a slightly more limited bill this year that's going to seek to bring greater transparency for our Attorney General into a wider range of transactions. Currently, the only types of transactions that the office really gets any notice about are hospital transactions, not private equity transactions, not anything else. This is going to increase the range of what our Attorney General knows about so they can, if needed, intervene in monopolistic or antitrust behaviors sooner. As well as it will give the Attorney General more ability to ensure that charitable assets and nonprofit transactions are guarded in the trust, are guarded for Coloradans in the interests of the public. So that's one bill that you're going to see come forth that we are excited to work on and look forward to hopefully not having to talk about again next year. For the second bill I'll talk about is the Health Insurance Affordability Enterprise. This is another really important part of our safety net for coverage in Colorado. So who here has been hearing about enhanced premium tax credits recently? Most people, this is more than normal, right? That's not a function of my job for that to be an understandable term for people. But at the federal level, this has really been the crux of the conversation about making healthcare more affordable through subsidies. And we know, right, although there's been some action recently, that there has not been a finalized effort to extend those enhanced premium tax credits that were help keeping millions of people across the country insured. And so with kind of those threats from the federal level, but then also some challenges in revenue at the state level, the Health Insurance Affordability Enterprise's affordability programs, which include reinsurance, subsidized coverage for low and middle income Coloradans, and Omni Salud, which is a coverage program that helps people access coverage that can't do so otherwise through the exchange. So right now that's our undocumented Coloradans, although that population of folks who can't access coverage through the exchange is going to increase because of HR 1, right? So these coverage programs have been under threat. There was an attempt to address some of the problems last year that failed in the 2025 session, but you might have noticed if you were following the special session that there was a bill to do kind of a stopgap solution that helped keep around 28,000 people covered and gave some flexibility to reduce reductions in Omni Salud, which is not a phrase that I would love to use, but Omni Salud was facing a 75% reduction in spots. It was covered 12,000 people who had no other options and was looking at only being able to cover about 3,000. With the bill, we were able to keep 6,700 people covered, but also really reducing the quality of that coverage. So some really hard compromises have already been made. And to keep the reality of what we have now, which we know is not even sufficient, we need 139 million more dollars. So there are cascading effects of what's happening at the federal level, but also many of the state level restrictions on revenue that we've already started to talk about in coalition with our partners. And so we know that these coverage programs are really critical for our low and middle income Coloradans, our rural Coloradans, our immigrant Coloradans. So back at the table again for what may end up being a short-term solution again, but what we hope is more of a long-term fix. So this year, sponsors, Representatives Brown and Gilchrist and Senator Judah, with collaboration from Senator Malika, have been pulling together members from across the healthcare community since coverage impacts everyone, right? When folks are not covered, providers don't get paid, folks can't access their coverage, and it harms employers' ability to keep and retain staff, right? So the policy will be looking at exploring new short and long-term revenue to make up for that deficit in the 2027 plan year and hopefully beyond, as well as redesigning the waterfall and the reserve system to ensure greater transparency and stability for these programs. The fluxes in Omni Salud in particular, but also right across these programs, are not helpful for some of the folks who have the fewest options for healthcare coverage in our state. And so we're hopeful that kind of with this stress test, the Health Insurance Affordability Enterprise has been under, we've seen some of the cracks in that system and can design the system better moving forward. And so then finally, I'll give a bit of a teaser, not many specifics, but stay tuned since I know this is an issue that matters across economic justice, healthcare, and all the issue areas we all work on, frankly, is medical debt. So we've been proud that Colorado has been a leader in the medical debt protection space for years, but that doesn't change the fact that the high costs of care keep going up. And unaffordable coverage means that many folks are still suffering under the unexpected and cascading effects of medical debt and the financial toxicity that is associated with it. We see this day in and day out through our consumer assistance program and with Coloradans that we talk to across the state. And we know further research shows that more than 1 in 3 adults have delayed care for fear of financial ruin due to unknown prices. I know I have, I'm sure other people in this room have, or people we know and love have, right? And those burdens are not felt equally. They're felt by folks who are already struggling with systemic inequities. And we know that delaying care is not only right, ends up harming us, but also is more expensive in the long term. So it's important to make sure we address the cost of care, but then also really help folks navigating medical debt now. So this is only, we fear, going to get worse with what's happening from the federal level. We fear that with reductions in coverage on the horizon and continued increasing costs of care, that Coloradans are only going to be more under threat from medical debt. And so it's more important than ever that we continue to take steps to strengthen the safety net that we have, because we believe, and I hope everybody shares, that every Coloradan deserves to access healthcare without fear that an unforeseen medical emergency or needed care will spiral into financial toxicity. And so we're excited that there will be a bill to strengthen basic economic and human protections from predatory debt collection practices that harm people's ability to access care, as well as pay it back. So we are excited to share more details about this with you in the days to come, and reach out if you'd like to get involved. And with that, I will pass it to my friends at CCLP to check in on other exciting but also sad things happening.
Hi, everyone, and I appreciate the background given by CFI and CCHI because that will make my job easier. I'm Bethany Prey. I'm the Chief Legal and Policy Officer at the Colorado Center on Law and Policy, and I'm talking about public benefits.
And hi, my name is Melina Taya. I am a policy advocate and licensed social worker at CCLP, and I will be presenting on the Robin Alerts bill that will be introduced in the upcoming session.
But there are 3 big reasons that policymakers are inspired to change Colorado's public benefit system this year. And you've heard about 2 of them, Tabor and HR 1. In addition to what HR 1 is doing to our budget, it has other impacts on our state system. It expands or adds work requirements in SNAP and Medicaid. It will require programming, public outreach, and a ton of new work for the 64 counties who administer public benefits. And it will result in huge financial penalties if Colorado does not reduce the number of errors it makes when determining eligibility for SNAP and Medicaid. So we face this challenge knowing how much Colorado struggled with the public health emergency unwind. So from 2023 to 2024, counties had to review eligibility for the 1.8 million Medicaid enrollees who had gotten coverage during the pandemic. And Colorado's rate of improper terminations was among the highest in the country. In addition, the state was put on corrective action at the same time from the federal government for delayed decisions on SNAP processing. People went hungry and lost access to health care. Slide. So to align with the House HR 1, the state will need to bring a bill to change eligibility requirements in Medicaid for people in the expansion population. And just as a reminder, that population includes single adults, and it also includes parents if their income is between 68 and 135% of the federal poverty level. The state has not shared its plans, however, and will be enlisting advocates and community members to help make sure the law protects the rights of Coloradans and requires data collection that we'll need to know what the impacts are of HR 1. Excellent. The one factor that affects eligibility processing in our state budget is county administration. As the slide shows, it's costly, but cost is not the only factor. The state also struggles to oversee county processing, and we've seen problems with inadequately trained county staff, big backlogs, and failure to provide language access. Next slide. And HR 1 is going to add to that county workload that they already struggle with. Already, more than twice as many people may have to comply with work requirements in SNAP because the age limit has gone up to 64 and veterans and others are no longer exempted. Work requirements and more frequent renewals for the more than 300,000 people in the Medicaid expansion population begin January 2027. As a result, there are multiple proposals in the budget and as potential bills that would regionalize the processing of benefits with the goal of improving member experience, reducing costs, and ensuring that we have a better accuracy. Those proposals include budget amendments that you'll see in the resource page. But this is a really dynamic space, and we're going to need the best thinking of advocates, counties, state departments, and community members. So please stay tuned on that. Next slide. And last, there are proposals involving technology and program funding, including a HICPUP, healthcare policy and financing budget amendment from January 2nd, where I'm paying to say they plan to rely on a mostly manual and burdensome process for work requirements until mid-2027 or 2028 because reprogramming takes that long. Our dysfunctional benefits management technology is managed by a very expensive for-profit vendor, Deloitte.
Boo.
We can't afford the errors or the continuing costs. So CCLP supports replacement proposals that have been presented and that are initiated with a new budget amendment. Community members must have the opportunity to help shape that vision. Another interesting legislative proposal is coming from Representative Foray, which aims to make large corporations more accountable for their dependence on Medicaid for employees. And funding of proposals are also included to help defray SNAP administrative costs that the federal government has offloaded onto states. At least some of those costs will be covered thanks to ballot measure NM led by our friends at Hunger Free Colorado. Thanks for that. And now I'm moving from public benefits to the utilities infrastructure.
Okay. So Colorado has had ongoing problems with communications and power companies. We can reflect on the most recent event being the plant outage from Xcel Energy's wildfire mitigation plan. That was last month, December 17th to the 22nd. Prior to last month's power outage, CCLP has been investigating the utility providers' communication and safety structures. The map on this slide shows that in black, Xcel Energy's jurisdictions, and in pink, the southern Colorado part along the I-25 corridor are the only areas where the Public Utility Commission is regulating them. The rest of the state is not overseen by the Public Utilities Commission. CCLP found that as of August 2025, around 35 of the 52 service agencies and municipalities do not notify customers about power outages. Of the 17 that do provide notices, they do so through consumer accounts if you're registered, and it's usually one individual, and or only Facebook. Additional previous investigators from the Public Utilities Commission on recent Xcel Energy electric outages found that the average customer had 350 minutes of outages in 2024. In 2024, customers had more and longer outages than in previous years. With the increase in outages but no change in communication, CCLP developed this policy for the 2026 Colorado legislature. So power outages have adverse health outcomes and worsen diseases such as COPD, cardiovascular disease, prescription refills, and in worst cases, death. In this specific situation, death was the outcome. On September 6, 2024, Robin Cox utilized an AC oxygen concentrator for her COPD who lived in Delta, Colorado, passed away following an unplanned power outage. No communication or notice was received during or following the outage. Her family found her in her home and only learned of the power outage from the 911 operator after they dispatched the paramedics. Her family proceeded to conduct an investigation into the utility service organizations, as well as state and local policies. Named after Robin, the Robin Alert policy is a standard communication framework that service providers would be required to follow at a minimum when a planned or unplanned outage occurs. The minimum service provider would notify their consumers at a minimum of a phone call or text. We also ask for service providers to consider email, local radio, and local news stations based on the number of consumers impacted by that outage. This allows people to contact those who need either to connect to their loved ones or ensure that they're connected to their medical devices, turn on generators, and plan for safety. There's a lot of information that we don't know since these utilities are not being regulated by the PUC. This policy would require electrical utility providers to submit quality service reports to the PUC. These reports would include customer complaints and grievances, power outage instances and impacts, wildfire mitigation and public safety shutoff plans, community engagement activities, and billing programs and shutoff policies. There is currently no fiscal note, as many of these utility companies are already doing this and have the capacity to do so. If they have the consumer's numbers for billing, they have their number to call. So this bill is a bipartisan effort. We have our meeting sponsored Representative Matt Soper and Representative Elizabeth Velasco, who are bringing this to the legislative floor. A very special thanks to them for their help in making this bill possible. If you're interested in joining our efforts and would like to receive updates, please sign up with the link in the chat. If you have any questions or comments regarding this policy, feel free to email me.
Hi, everyone. Thank you so much for being here. My name is Andrea Kulik. I'm the Director of Policy and Research at the Bell. I'm joined by Josh Mantel, who's our Director of Government Affairs. And for those of you who don't know us, we as well are a nonprofit, nonpartisan policy advocacy research organization, really focused on economic mobility and making sure it's available and accessible for every Coloradan. So I'm going to talk about two of our big policy focused areas, and then I'll hand it over to Josh. So the first that really going to focus on is around high cost lending. And so when I talk about high cost lending, we're really talking about those products that have those high APRs, that have those high fees, that have those high charges, that are really associated with cycles of debt. So really what happens, folks take out these loans, they find themselves in a pinch, they have these high fees, they have these high charges that are tacked on to taking out these loans. And so they find themselves in a challenging spot when they go to repay these products and to repay these loans because they're already financially strapped. They have these high fees, high charges that make it even worse. They go to repay them, find they can't, need to retake out a loan again. And so they find themselves in these continuous cycles. And so that's really what we're talking about with high cost lending here. So we are a national leader as it comes to consumer protections for these products. But what we've seen over the years is that there are continual attempts to circumvent the laws that we already have on the books. And this comes kind of in two different forms. So the one of the forms being around new products that say we shouldn't be subject to our state's laws. The second one, which I'll also talk about, that we also see some efforts around, is really saying from these high cost lenders who come and say, well, we don't think we should be subject to these rules and regulations that you have currently. So we're seeing this on two fronts this legislative session possibly. And so starting with those new products first, we're seeing the advent of a new product called earned wage access or earned wage advance. They're essentially the same thing. They are the same thing. You might know them by EWA. And so these are really a new product that operates essentially like a payday loan. It's just an online payday loan. And so essentially folks are going in, they're borrowing against their future wages, and then in exchange for doing that, they pay a fee or a charge for that. Importantly, we have seen that when people take out these products, it does lead to a lot of those same outcomes as payday loans. So those cycles of debt that are, again, are associated with payday loans, we see those with EWA as well. So folks may remember that there was an EWA bill last year. And whenever you see it on paper, you say, oh my gosh, this is great. They're coming in and they're trying to regulate this. This is wonderful. But when you take a look a little bit closer, what's actually happening is the industry is coming in and they are saying, well, you should regulate us, but on our own terms, at allowing us to charge higher rates than you would for things like payday loans, exempting us from a lot of the different regulations, a lot of the different reporting requirements that we have for these payday loans. And so when we saw this bill last year, we had a lot of concerns. We worked with a lot of amazing organizations, many of whom are in the room with us as well, to say, if we are going to regulate these products, which we need to also ensure that there are strong consumer protections that are in place for these products. And so we tried working with the sponsors last year. It did not work. We do expect a bill to come back this session. We do want to have regulations on these products, but we think that the most important thing that's going to be in place for these products, or we should have in place, is making sure, especially for those folks who take out these products a lot, that will take out these products 5-6 times a month, that there are strong consumer protections to make sure that they're not falling into these cycles of debt. So that's one of the products and one of the things that we are looking at this legislative session. We know that there is going to be legislation. We have also have some concerns that another high cost lending product, it's called supervised installment loans. They're often a lot just higher. You are allowed to take out more money whenever you take out these products. Again, another high cost loan. We have some concerns that the lenders are going to come in and say, well, your 36% rate cap that everyone has been supporting in the state for so long isn't actually working anymore, and you need to increase our rates. And we think that that would be a big problem for the state. So that's something we're going to be watching out for, and we would have strong concerns with. I think all of this on our end really points to the need for better data on high cost loans, both who's taking out the loans, the impacts for those who take out these products, what this looks like across different demographic groups. Because so much of the time we have relied upon the federal government to have information around who's taking out these products, what the impacts are. The state sometimes just is a little bit further behind. But with so much of the rollback from the federal level, especially around the CFPB, the Consumer Financial Protection Bureau, we said it would be really helpful if the state was collecting this information. If we can make our own regulations at the state, we had our own state-driven data, that would be incredibly helpful. So that's also one of the things we're going to be looking at in this area. So moving on to the next slide, I'll just briefly touch on another of our priorities for this legislative session. It really does have to do with data of a different type. One of the other issues we work a lot around is around our aging population. A lot of folks don't recognize this, but Colorado is one of the fastest aging states in the country. Our workforce also is aging. Older adults are one of the fastest growing segments of our workforce. Unfortunately, we don't have a lot of data on older workers. A lot of that data stops at the age of 65. So that creates a lot of challenges, especially as we think about, do we have the right services, the right supports for this older and aging population to make sure that they can reskill, upskill as our economy changes. So we're working with Representative Wilford this legislative session to have better data collection for older workers, better coordination across state agencies to ensure that we have, again, this data, which will hopefully allow for better services and supports for our older population. So with that, I will hand it over to Josh to wrap us up.
Thanks, Andrea. As Andrea mentioned, my name is Joshua Mantel. I'm the Director of Government Affairs at the Bell Policy Center. I want to talk a little bit about the budget, just going over some of the things, some of which has already been discussed, and then I want to get into some of the solutions that we possibly have for some of the budget issues that we have. So just to restate, we have been in budget cutting mode at the state level for a while. And, you know, we talk about these numbers, $1.2 billion in cuts this last fiscal year, an additional $750 million because of HR 1. These are some pretty esoteric numbers that really don't get at what we're really facing. We're looking at some pretty significant disinvestment in our communities and in the people of Colorado as a result of the issues that we have. And a lot of this is driven by the Tabor limit. We have a Tabor limit, a cap on the amount of money that we are allowed to spend, regardless of what we bring in, that is not keeping up with the actual needs of our state. It is governed by the addition of inflation growth plus population growth. And if anybody has ever dealt with healthcare, you know that healthcare costs rise significantly faster than the rate of bread, milk, and eggs. And the government does not spend money on bread, milk, and eggs. The government spends money on healthcare, and education, and a few other things. And so we're looking at these cuts because the Tabor limit is not allowing us to keep up with what Coloradans actually need. And so we're looking at, as was mentioned by our friends at Colorado Fiscal Institute, about $840 million in the hole this coming year. Next slide, please. And so what does that really mean in terms of real numbers and real costs to the state? Well, it means that for our K-12 public education system, we're 50th in the nation in teacher wage competitiveness. That's dead last. Adequacy studies show that we are $3 to $4 billion behind, not just behind having a great education system, but behind having an adequate education system. We have healthcare costs, as I said, rising faster than inflation. And as Andrea said, we're a fast aging state, which means that we have more people in our state that need long-term services and supports, things like home healthcare aides, nursing home facilities, old age homes, those kinds of things. And that's increasing the amount of costs that we need through Medicaid that is much higher than the cost of inflation. We have our child care assistance program has been turned off across the state because we do not have the money to accept more low-income families, which means lost wages because parents can't go to work because they need to take care of their kids who are falling behind because they don't have the education and the social needs met through a child care center. And then we saw significant cuts to transportation grants across the state this last year just to balance our budget because the choice in front of them was cuts to transportation or cuts to meals for families so that they couldn't put food on the table. And I think, unfortunately, we are looking at a series of bad choices across the board in order to just balance our budget. Next slide. So that's just the current landscape. Going forward, as was mentioned, we have significant costs associated with HR 1, whether it's SNAP administrative costs, Medicaid administrative costs, the cuts to the hospital provider fee, the shift away from federal government investment in our supplemental nutrition assistance programs to counties, which do not have the money to support that, as was mentioned by Colorado Center on Law and Policy. And so we're looking at billions of dollars of lost funds as a result of what has been at the federal government starting in 2027. So we have these significant challenges now that are just going to get worse as we go forward because of what has happened at the federal level. Next slide. So, fortunately, there's a solution in front of us. And that solution is a graduated income tax, which asks our wealthiest residents and corporations to pay their fair share while helping out low and middle income Coloradans by giving them a tax cut. And we can do that. We just have to go to the ballot in order to do that. So what are we going to do? We are working with partners across Colorado. Our three organizations that have already spoken today are steering committee members of Protect Colorado's Future, along with groups working in the childcare space, working in the environmental space, working in the democracy space, working in the immigrant space to really understand what is needed for Colorado. We will be striking a sentence from the Taxpayer Bill of Rights. Right now, it says that all income must be taxed at the same rate, which means that millionaires and billionaires pay the exact same tax rate as everybody else, and they get access to the loopholes and deductions that were mentioned that even allows them to pay less of their income in taxes than low and middle income Coloradans. We're going to cut taxes for 97% of Coloradans. Everybody making below $500,000 in income per year will see a tax cut, and then we'll gradually increase the tax rates on income above $500,000. And that would be the same structure for corporations. This would not change any kind of Tabor rebates. It would not affect the ability to vote on tax increases, but it would strike at the most egregious parts of Tabor and allow us to continue this work in order to continue raising revenue to support the needs of people across our state. We would raise $2 to $3 billion in revenue for the state that would go towards our healthcare system, including mental behavioral health, as well as Medicaid, our K-12 education system, and help families and the workers in our childcare space so that they can afford to live where they work, as well as ensure that families can afford and access childcare that we know is so important for those families as well as our economy writ large. And so we are looking forward to getting this on the ballot in 2026. As you can see, all of the groups that are right now working on this effort here in Colorado. We are going to be getting a title here that will allow us to start collecting signatures. We need 125,000 signatures from all state Senate districts across our state. And we will be looking forward to getting this on the ballot and really striking at Tabor for the first big time since referendum C, and really the biggest strike to Tabor since 1992 when it was first passed into our Constitution. We're really excited about this effort and really looking forward to really asking Coloradans what kind of future they see for themselves and their families and their children. Is it one where we have to cut our healthcare so that only the wealthiest people can afford to go to the doctor? Or is it one where everyone has accessible, affordable healthcare? Is it one where you have to go to private school to get an adequate education? Or should our public education system really be able to support all kids and families across our state? These are the kind of questions that I think we all know the answers to, and I'm confident that Coloradans know the answer to, but is one that we need to go to the ballot in order to really get that final answer. And so we're looking forward to doing that, bringing a campaign to every corner of the state and really making sure that Colorado works for everybody and not just the wealthy few.
Woohoo! That was fantastic. Lots of great information shared over the last 40 minutes or so. And now we've arrived at Q&A time. So Lydia is going to help me facilitate that, CEO of CCLP, sitting to my immediate left. Yeah. Lydia's going to keep an eye on the room, see if we can get folks in the room.
Anybody in the back.
Yeah, involved. And then I have a list of questions that have been submitted online. And then also, if you're online, but you haven't written your question down, you can raise your hand on Zoom, and our tech team here will see your raised hand, and they'll be able to put you on speaker here in the room so you can ask your question directly.
So these can be questions about what you just heard today. They can be questions about the legislative session, about the ballot measure, whatever. This is our time to have conversations. We do have 300 people online, so there's a chance we may not get to every question. However, we're keeping them together. Last year, we compiled those and we got answers out later. So don't hesitate to raise your hand or add a question into the chat, because even if we don't answer it right now, we will get you an answer. We've got all the expertise we need. So should we start in the room?
Sure.
Let's start in the room and we'll jump online. Anybody in the room? Yeah, I see.
Hi, Mike Elliott, I'm an attorney. There's a lot of stupid laws on the books criminalizing like victimless crimes. The state spends a ton of money arresting people and prosecuting people for simple things like drug possession where there's no victim. Why is this not being considered on the chopping block of state funds that can be cut, as opposed to cutting something like Medicaid, which actually keeps people alive? Right.
Great question. I don't know if we have an answer for that question per se, but would anyone like to field gather a guess? Ani?
I mean, I think what I would say,
Ani Martinez with Colorado Law Policy.
I think the answer is, that whole public safety argument, right? It's a very appealing thing to tell people, tell voters, tell constituents that we're prioritizing your safety, and the only way to do that is to keep pumping money into the systems that don't actually perpetuate any safety, which we know they don't. But breaking that wheel of misinformation is very challenging. And so I think that I'm very passionate about it, having been a former court-appointed defense attorney, and I do have a lot of passion about that topic, but it's not one that's easily answered because it is one of the easiest areas to get people to buy into the false message that by putting money into policing and prosecution, you're actually keeping communities safe when we know it doesn't.
You want to answer as well?
Yeah, I'll just add, this is not, we're not leading it at CCHI, but the Colorado Criminal Justice Reform Coalition is also actually leading an effort at the legislature to stop them from continually increasing the amount of money that our state spends on building prisons. So actually in these years where we've been cutting our social safety net, they have spent more money to build more prisons. And so that there is an effort to try and say, if you're cutting things, let's talk about the ways that we should be managing folks' populations and managing folks' ability to move through the justice system instead of building new prisons. And so if you're interested in that effort, I know CCJRC is trying to push that. at the joint budget committee and the joint budget committee so far has chosen at every time to increase the fund for new.
This is the last thought. I would hope that because we need to cut money, we maybe would stop thinking about over incarcerating and over criminalizing, particularly non-violent, victimless crimes. Now seems like the time to actually get people to consider this, since we're in such a desperate situation. Thank you.
Yeah, appreciate the question. I'm gonna go to one of the ones we took from online earlier. This one is a good segue from our very last presentation with Josh. Charles Peterson asked, will the graduated income tax legislation be placed on the ballot through the collection of registered voters' signatures? And I think Josh can talk about that a little bit. But if so, when and how can we sign up to begin collecting signatures? And I think, Lydia, since you're up here, you want to take that one?
Yeah, sure. So we are in the process right now of putting together the infrastructure that will support volunteer management, and we definitely will need a lot of you to step up. So we don't have an opportunity at this moment, but if you're on any of the email lists for the 4 organizations that are a part of this event, we're all part of the steering committee, and we will be sending out lots of information about where you can go to the website to sign up to volunteer. So we're in the early stages of making sure we get that title just exactly how we want it. Once we have that locked in, we'll have something to ask people to sign. So lots more to come. I'm going to pop over here because he had his hand up first, and we'll go back online, then I'll come back to you.
Hey, yeah, so this was actually a specific question for Colorado Consumer Health Initiative. You'd mentioned previously that a lot of the bills that were introduced here were bills that had failed last year. So what would be the strategy to actually make sure they go through this year and have enough support to actually pass?
Yeah, I think that's a great question. So a big challenge with last year's session and with the beginning of the Trump administration was kind of the onset of the conversation around what became HR1. And so I think a big theme of last year's session was a lot of uncertainty about what was moving forward in that regard. And so what we have now is more certainty, for better or for worse, because it passed, right, rather than it being debated. And so I think now that we know what HR1 has done and will do, there is even more of a case for some of the things that we're working on. When last year, before it had passed, it felt a little bit like ethereal for legislators. It felt a little bit like, why would we control for that now if that's not going to happen? And then in the summer, we're like, oh no, like all these people are going to lose access to healthcare. We're like, we know, we tried to talk about this. And I think the same with some of the other bills. And I think it's a challenge, right? Because I think many healthcare providers are facing increased challenges with HR1, but we also know consumers are going to face increased challenges. So we're ready to really have that debate and really try and move forward with a broader coalition that also includes healthcare providers to move things forward, because it's not going to happen with just consumers as well.
So another one from online, from Longmont AAUW Incorporated. Will the proposed federal education tax credit affect directly or indirectly Colorado's tax revenue if we opt in? So CFI.
It could. If we opt into that, I mean, as far as I know, it's structured as a credit. And so, and we've just been looking at it as a way of like basically creating a pathway to vouchers in our state. And so, but that's the most I can say. It's just, it could. Okay, depending on how it's structured. There's still a lot to do on that, so.
More to come.
It could, yeah, it could. Sorry.
No, that's your answer. Thanks, Captain.
This is for the last presenters, policy, the Bell Policy Institute. Could we look at lowering the threshold? Because I think 500,000 is a lot. People who earn anywhere beyond 175,000 should pay great taxes already. And people who earn less than that are the ones who should pay almost the minimum level possible.
So I think that's a really interesting question. And a couple of things on this. One is, making tax policy through the ballot is a bad way to run a state.
Here, here.
And that is the crux of all of this, I think, is we elect our representatives and senators to make hard decisions, tough choices that benefit their constituents. And if we don't like the choices, we vote them out. That is how our system is meant to work. We have these constraints that have been put into our Constitution that allow them to pass all of that on to the voters who have 9-to-5 jobs, don't think about tax policy regularly like I do, unfortunately. And so we're forced when we bring something to the ballot to think about what can actually pass, what is actually popular with the people of Colorado. And when you ask them what is wealthy in this state, you get answers like yours that are, you know, if you're making over $100,000, you're doing just fine and you're wealthy. And we have a lot of people that say, you know what? If you're not making $500,000, you're not wealthy. And so we don't think that, so we think that those folks need a break too. I think there's some truth to that. And there's a lot of wealth and income in this state. Let me be clear. Raising $2 to $3 billion from 3% of Coloradans, I think just that math shows how much income inequality has gotten out of control nationally and in Colorado specifically. And so I think in my ideal world, I would like to lower that threshold too. I think if you ask the people of Colorado, that's what makes most sense. And it fits kind of this Goldilocks problem of too little and too much that I think a lot of people have. And so, you know, we're trying to measure the policy with the ability to actually win the campaign that we know we need to help the people of Colorado. And so that's kind of where that number comes in. It's not science, it's more art. It's not how I like to craft policy, but it's what we have to do given what we have with our system.
Gotcha.
Thanks, Josh.
Yeah, so this one's from Shar. Is any legislation being considered that's designed to address the Trump administration's withholding of funds from Colorado? For example, withholding federal payments if lawmakers determine the federal government is delinquent on funding owed to the state. She says lawmakers have introduced similar bills in at least 4 states, Connecticut, Maryland, New York, Wisconsin, Washington, and Pennsylvania. This type of out-of-the-box thinking seems warranted given our fiscal challenges, but I think it's also a larger question about the withholding of federal funds and the impact of that.
I'm not sure sort of the Bethany, So, I mean, there is a lot of creative thinking happening in Colorado also. It's not necessarily being aired because there's also a concern about what happens when you air your thinking about withholding of federal funds. So we have a lot of litigation underway. There are, I think, 5 lawsuits we're involved in that are SNAP related, many of which are information about sharing of information and privacy of information, as well as threats to withhold funds for other reasons. So this is like an ongoing battle. Litigation is going to be a tool that we need to use a lot. And then also, you know, I think more discussion between the community and the departments as well about what is the outcome of conceding and providing information or trying to obey what are like a random and changing set of demands that are contrary to really what we want to see in public benefits. So I think it's an ongoing conversation, but I hope that everybody who has an opinion on this will weigh in as much as they can with the legislature and the departments, because they need to hear that if we don't want to back down, they need to hear that we all will have their backs.
And I think I saw a hand up over here.
It was just a follow-up.
Okay, no
Josh.
problem. I'll ask it really quick. I was just curious. Where's Josh? Where'd he go?
He's hiding.
I'm back to the question that Jose posed. I'm just wondering, do you have data that tells us what the percentage of Coloradans are that make under 500,000 versus the percentage that make over 500,000?
97% of Coloradans make below $500,000. 3% make above. The top 1%, I think right now is about 850,000, give or take.
Yeah.
And so, you know, again, like with our measure, we will be giving tax cuts to 97% of Coloradans. And we will be raising taxes on just those 3%. And again, it's a very small percentage, even as you get higher and higher. And so the tax increases, I don't think will be fairly prohibitive. And that's just kind of where we see the math working out to get the amount of money that we think we need to really start to get fiscal solvency in our city.
Yeah, thanks.
Can I also just add on for people who, the graduated income tax, so it's not like it's turning on a light switch. So if you make over $500,000, every dollar of your income is going to be taxed at that higher rate. If you make $520,000, for $500,000 of your income, you're going to get a tax cut because the rates are going to be lower. But for that $20,000 that's above that limit, you will pay that higher rate just on that $20,000. So we tax income in stair steps. We don't tax people. So I think a lot of people are like, oh, if I make $700,000, I earn every penny of that. You're not tax me. Well, you're gonna get a tax cut at the bottom, but that extra income that you get above that threshold is gonna be taxed at a higher rate. So
We're gonna go
just
back
want to be clear
online.
about that.
Yeah, we're gonna go back online. So I'm gonna kind of consolidate three questions here because they're all about the ballot measure that we're already talking about. A lot of questions about that coming in, as you might expect. Drew asked how the title board has ruled so far on the graduated income tax, which I know is a complicated story, but that also relates to another question we have about the timeline. When will the final language be available? And then the final one I think we can roll into that is what is the organizing strategy to get the necessary ballot signatures? Will it all be volunteer driven or will there be funding to pay canvassers?
So I'm actually going to talk to my son's 5th grade class about this process on Friday. So the title board is made up of 3 representatives, one from Legislative Legal Services, one from the Secretary of State's office, and one from the Attorney General's office. And their whole world view when they're at this table is how can we make sure that whatever is put forth in front of the voters is clear, is written in the way it's intended, is accessible to voters, and is not trying to do too many things, more than one thing. So it has to be a single subject. One of the tricky things about what we're undertaking is that the language in the Constitution that we are omitting was written before the single subject rules, and now we have to abide by the single subject rules. So that's this process through a decision making with the title board that's really nitpicky. So this is like real legalese. People start kind of spinning on like, oh, what's this and that, and the periods there. So this process we knew would take a lot of time, which is why we started early. We are 100% optimistic that we are going to get a title set. We have lots of different options of how we want to pursue it, and we want to make sure that what we finally put in front of the voters is the best possible policy for Colorado. So we're in the kind of final throes of that right now. We've put in a lot of time and effort, learned a lot about the process, and in each step we've refined and made our position stronger. As far as timeline on the process, again, that's something that we'll be putting together in the next coming weeks to month of really looking at how we're going to be hitting the ground running on the signature collection. So we'll be hitting every county in the state, and we'll definitely need a lot of hands on deck. So more to come. Does anyone else in the coalition want to add to that? Great.
Yeah, I have a related question, but I'm curious, as you're working through the titling and everything, if 97% of people will receive a tax cut, what are you anticipating as like the biggest challenges or barriers to impact or getting enough signatures, like people being in favor of it?
Lack of understanding of what we're trying to do, I think, is our biggest barrier. So if we can, what we learned from message testing and polling is that if we tell people what we're doing and it's clear, they're like, oh yeah, okay, of course. But if they get misinformation, people are inclined to believe things like, well, people earned all those dollars, we shouldn't penalize them. Yeah, this is actually extremely common. Alex's face like, well, what? So people are like, oh, don't mess with people. The start of the ballot, because of the way that we have to write it, is shall Colorado taxes be increased by $4 billion? Some people are gonna be like, no, they won't read the rest. They won't know. So if they're not informed, that's really our biggest barrier, which is why we'll need time and money to fund this campaign, to make sure people understand what we're trying to do.
And I just want to add something to your question. I have studied this. Latino populations, for example, are by far the ones that vote against tax increases for the rich more than anybody else, and it's due to misinformation.
I think just to put a fine point on a couple of things. First of all, the amount of money that the other side is going to spend, the millionaires and the billionaires who are actually going to see tax increases is going to be exponential. And so, we know we have the people, they have the money. And so we need to make sure to get our message out. I think, the other thing is that, there's this idea that we are flush with money and we're just not spending it well as a state, which we in this room and online, as we've documented through all of our presentations, we know that that's not true. We have a fiscal crisis. And the more that we can make that fiscal crisis real for people to understand what is happening in their communities, that is actually because of the lack of funding that we have, whether it's because hospitals are closing down, or there's not enough mental health resources for folks, or their teachers aren't paid well. These are the things that are directly from the fact that we do not have enough revenue as a state to support the needs of every Coloradan. But not everybody kind of knows that and understands that. And so we need to make clear what the problem truly is in an individualized community way, so that people can really latch on to, okay, if this happens, then my community will get something that will actually help me make ends meet, that will help bring down the cost of living for me and my family in ways that is very tangible. I think when we talk about that we have $840 million in cuts coming, people, that's not accessible. That's not a way to connect with people. When we say that your teacher is not paid well because of the fact that we don't have enough money as a state, that's when the light goes off. And so the more that we can make those real connections, the better off that we're going to be.
We're gonna go online, then we'll pop to.
Yeah, one that I will start answering and somebody else can chime in too, but Mike O'Connell says, I love the work your organizations are doing. Thanks, Mike. Appreciate that. My feeling is that the collective outreach and visibility tends to be a little Denver-centric. How will you get the message out statewide about all of this work? And that's something that's, I know, a big priority for all of our organizations. At CCLP, we have a community engagement strategic priority and a community engagement team. So we work really hard on that, as well as our communications team. And I know I see a lot of these folks that you see up here presenting at events all out across the state, from Craig to the San Luis Valley and all across Colorado. So we get our staff out on the road. We try to do a lot of visibility and educational events as well. But, definitely, I think we always need the public's help with that. It's a partnership. It's a partnership with organizations in community all across the state to connect with them and make sure that they connect with their constituency and their folks and spread the word. So I think that's something that all of our organizations are actively working on, is making sure that we are not Denver-centric. But, it's a fair point. Here we sit in Denver. So,
Right.
But we are broadcasting live online across the state, which is, we do hope things like that, technology can help ease some of those barriers as well. Does anybody else want to talk about specific outreach work?
Yeah. I will say too, from the coalition at Colorado's Future, one of the first things that our outreach and grassroots team is doing is partnering and finding more voices from outside of the Denver metro area. And so that's really an important piece of the coalition of how we're going to get outside of Denver, is building this big, robust coalition. And so within the next weeks, I believe, we'll be having these really helpful, informative webinars to bring more and more and more partners in and organizations in to this effort as we move forward, before we even start going out to petitions. And so we need everyone's help here. If you're interested in joining our effort, we would love to bring you in and into this broad coalition and continue to build it out.
Well, my question is, again, the ballot initiative is getting kind of a lot of attention. What is the anticipated fundraising goal in order to run the field and messaging operation that you think you need to pass the initiative? Do you know what the
That's
number
a good
is?
question. How much do you have?
I know how to raise money. I don't have any.
I'm Christopher Kennedy. I'm the president of the Bell Policy Center. I mean, I think that we've got a lot of sort of scenarios we're looking at. I will say that one of the things that's different about this year compared to what campaigns like this have faced in the past is people aren't reading the news. People are pretty jaded about TV ads and fancy mailers. And so even the dollars that you would traditionally spend on a campaign like this don't actually make the difference that they used to make. And so while we will raise whatever we can and likely use some of those media as well, what we are banking on this cycle is a very, very direct outreach strategy where we want to get into conversations with people across the state. So this is not to discount the importance of money. We'll be raising money. We'll have a very robust digital program, and then we will figure out what the TV and mail programs need to look like based on what we think is actually going to make a difference for people right now. But what we know is 20% of the state gets their news from TikTok. So we need to be on social media, and they don't trust people that are, former politicians from Denver, but they do trust their own neighbors. They trust teachers and healthcare providers in their own communities. And so activating a statewide grassroots effort where people from your community are going to be knocking on your door to talk to you about it is, I think, the most important thing we can do to win this campaign.
Chris, you still need a lot of money.
And we still need a lot of money.
But we also, there's been a couple of years, over the last couple of years, a lot of the polling that people have been doing, one of the questions we've been asking people is, who do you trust to give you information on these complicated issues like tax? And the work that you all do with the organizations that you're affiliated with, those are the #1 ways that most people get their information. They do read the Blue Book, right? The voter guides, they do get those. But to understand them, they go to community organizations that they trust. And so if you can even just say to your neighbors or to whoever you're talking to, if you have questions about this, go to CCLP, go to another organization, or if you need one of those organizations and want to be a part of our work, because we know that that is the thing that makes the difference. People don't understand these issues. That's real clear from the focus groups and the polling that we've been doing. But when they hear it from somebody that they like and trust, an organization that they like and trust, they're like, well, this organization gives me good information. So even if you can add something to your newsletter, you don't normally cover tax, that's okay. Put it in your newsletter, whether you're the Humane Society or whatever you're doing, building housing, or you have a small business, whatever the case may be, this is good for all Coloradans. And so the more we tap into the places where people just interact naturally, the stronger our campaign is going to be. And I think that is a lower dollar than, but we do need a lot more money. So yeah, you have any.
Okay, Bruce, can you do one wrap up?
Yeah, so we're almost at 6 o'clock, so we're gonna do just one final question. But for the folks that are here in the room with us, these advocates are here right now physically in person. Feel free to chat with them after. I'm sure most of them will be sticking around for a little bit. We're gonna have a social hour for the folks that are here in person. We've got some refreshments and food available outside. And then for folks online, we didn't get to all of the questions, but we will commit to doing written answers to those questions and posting them in our event wrap up afterwards. So we will publish that. We'll make sure that no question goes completely unanswered. But one that I think is a good wrap up, just to bring us back to the legislative session. Someone asked, will a list of the bills and bill numbers being presented today be provided? Which is a very good question because we presented a lot of bills today and a lot of information, how to keep track of all that. So there's 4 different organizations here. I would recommend following us on social media, spending some time on our websites when you have a chance, because each of our organizations will be posting constantly throughout the legislative session. Our communications teams will be updating about each one of these bills. So there will be bill numbers available as soon as they happen, as soon as those are introduced, once the session starts. And I think if you're following on the slide deck here, you can see QR codes that are available. So you can hop to those websites, support our organizations. And one of the best ways to do that is by consuming all that information we put out and staying up to date. So I appreciate everybody staying in touch.
To emphasize, during the legislative session, all of our organizations will be expanding a lot of different bills that we engage in, and things will change and more. So definitely our website is the best place to keep track of what's going on, because this is just a taste of what really will be undertaking this session.
And there are no bill numbers yet.
And they're from the builders, yeah, right, but there'll be so many more bills that.
That's right. Well, thanks everybody, online and in person for joining us this evening and spending your time with us. It was great to have you here. Really appreciate it. And, we'll see you out there, on the streets of Colorado doing this advocacy and helping us, move this movement forward. So thanks again. And with that, we're going to wrap up and we're going to turn off online and have a little social hour in person. So thanks, everybody.